You do not look like somebody who had a three-level fusion, 8 screws, 2 rods, 3 spacers just yesterday, less than 24 hours
Yeah.
ago. How do you feel?
I feel good.
So tell me about the pain level. How bad is the pain right now?
Pain right now is about a 3 or 4.
Okay. Now you told me about actually about another of your neighbors who had
A lady lives across the street from me, and she had a similar surgery.
but open.
But open. And she showed me her scars, and there was about a 6-inch cut on each side of her
Vertebra.
her vertebrae.
Mhm.
And she had a lot of pain afterwards with it too.
Mhm.
But I don't know if she had any complications. She didn't say, but.
Mhm.
When I saw that, I was researching and I was
Yeah.
looking through the internet to find, spine doctors.
Mhm.
And she gave me her doctor's name, which I wrote it down, but I didn't do anything with it.
Mhm.
I looked into Rochester, and the thing I don't like about Rochester, I've had 2 surgeries there, and they use a team approach.
Mhm.
And so I had a hernia operation, right side, and the top guy in the group, he set up the surgery and everything, but he didn't do the surgery. His
Yeah.
number 2 guy did it.
Yeah.
And the number 2 guy did the whole works after that, the follow-up and everything, and I never saw him again.
Yeah.
So I wrote him down, and then my niece recommended a doctor that does it for the Minnesota Vikings.
Oh, okay.
And I looked into his background and his training and stuff, and then I found Inspired Spine, and I found you
Yeah.
in the cities, and I looked at your background and your training that you had done over in Germany and in the U.S., and the fact that you've written many things, and also you teach
Yes.
other doctors how to do the procedure.
Yeah.
And with an invasive surgery, you told me that there's less chance of pain and hitting nerves and stuff like that.
Yeah, with minimal
That
invasive.
convinced me,
Yeah.
that you were the right guy for the
Yeah.
job.
Well, so far it's just the day after the surgery. Have
Sure.
we delivered so far? Your expectations?
Yes,
Yeah.
definitely.
So no, you got one of the biggest surgery anybody can get, a 3-level fusion.
Yeah,
And I was just looking at the surgery was done less than in 70 minutes actually. The
Yeah.
exact time was
That's
67
amazing.
minutes.
That's amazing.
And we put the 4 on each side 4
Yeah.
screws, so total of 8 screws,
Yeah.
3 spacers, 2 rods. And surgery was just yesterday afternoon. And most of our patients go home actually one day after the surgery. Obviously, it still will be difficult. Certain things, bending, twisting, lifting will be difficult.
Sure.
But after have seen thousands of spine surgeries,
Mm-hmm.
you do not look like somebody who had a 3-level spine for surgery yesterday.
Yeah, I feel really good today.
Excellent. Well, and this is the point, that we don't cause too much damage on the way of getting it. Before the surgery,
Yeah.
how long did you have back pain before the surgery?
How long?
Yeah, how many years?
Well, I had back pain for several years, but
Yes.
it was in the upper back,
Yeah.
and a chiropractor fixed that. Then I went to the lower back,
Mm-hmm.
and he fixed that.
Yeah.
Then what happened was arthritis got in there.
Mhm.
He couldn't adjust it anymore.
Yeah.
And so for the last year and a half, I've been in pain with it.
Yeah.
Had cortisone shots, had
Yeah.
physical therapy, everything,
Mhm.
and nothing worked.
Yeah,
So-
and you have a scoliosis as well. If you remember,
Yeah.
we looked at
Yep.
it together.
Yep.
Your spine, your vertebrae, your disc, they were collapsing unequally on each side
Yeah.
to the point that your spine was side bending significantly.
Yeah.
And the bone was literally grinding the bone. All of that is taken care of.
Yeah. And I'm retired, and
Yeah.
my one pleasure in life is golfing.
And
I golf almost every day, and last fall I could not. In October, I could not golf anymore.
that makes me really happy that one day after the surgery, you're thinking about your hobby, your golfing.
I am.
Because people after this kind of surgery, one day later,
Yeah.
they have other
Yeah.
issues. They don't think about golfing.
Yeah. I even tried to go out
Yeah.
this year,
Okay.
or actually a few weeks ago,
Mhm.
just to putt and chip.
Mhm.
And when you putt and chip, you just bend your back
Yeah,
slightly.
yeah.
and I could only stand it for about 10 minutes, and then the pain was there.
So-
So I knew I couldn't even golf one hole.
So it was time for you to get that fixed.
Absolutely, yeah.
So now, overall, I think the surgery went well. I will do the paperwork. It's a good chance you'll go home today.
Good.
But do you feel like going home?
Yeah, I
You
feel
do.
okay. Yeah.
Okay, good, good. Well, thank you so much. I'll talk to you again when you come back to the office.
Yeah.
Okay.
Okay.
Thank you so much.